In your course packet, there's a nice muscle test video that shows a manual resistive test on the posterior lower leg. I encourage you to watch that. So to start with the lower leg, we'll work on the gastroc. The gastrocnemius goes from the Achilles all the way up above the knee. So we'll search from the Achilles. You can do both at once or one side. A lot of times this can be a really tender area, so be careful and get lots of feedback from your client. Can you press against my hand here? Keep pressing. So you'll see nice outline of the gastrocnemius here and here, all the way up. Relax. You'll need to make several passes in the gastroc in order to cover all the muscle fibers. And be sure you're stopping distal of the popliteal area. Is this tender? So I noticed a knot in the client's medial gastroc, and instead of applying downward pressure, I'm just sifting through. I find better luck. That was a nice release. Did you feel that? I find better luck with sifting in the gastroc and in the upper traps as well. So you'll search both sides of the gastroc, belly, and then search medial and lateral femoral condyles above the knee. Go ahead and press here again. And relax. So I just had my client activate the gastroc so I could be sure I was in the right spot. And then once more, step on the gas. Great, relax. And again, with the gastroc, if you wanted to do active or passive engagement, you could add that. Passive, just simply lift the lower leg off the table and do some passive movement of the foot at the ankle joint. Alternatively, the client could press on the gas and release repetitively while you apply gliding techniques. So when the client contracts their muscle, the fibers slide together and are more dense. So it may feel more tender when they're contracting their muscle. And relax. For the soleus, we'll continue with the gastrocnemius by switching our direction and getting at the distal attachment at the calcaneus. Then we'll get to the soleus by searching from Achilles to the knee, except instead of coming down from the posterior side, we will compress the soleus from the sides since it lies deep to the gastrocnemius. Again, stopping and treating where you need to treat. Go ahead and press on the gas again and relax, contract, relax. So you go all the way up to the knee for the soleus. The tibialis posterior, you'll treat both laterally and medially, but more medially. What you'll do is find your bony landmarks, tibia and fibula, and kind of roll under the soleus and search tibialis posterior, particularly the medial side. Just a side note, if your client happens to have flat arches, this could be a particularly tender area. One of the main jobs of the tibialis posterior is to stabilize and lift that arch. So there may be some dysfunction or pathology in the tibialis posterior if your client has flat arches. And finally, we'll apply some cross fiber friction and circular friction to the Achilles tendon. And here you see I'm even doing some longitudinal friction.